Hello and welcome to Team Talk. If you haven't seen some of the other videos, check them out. We've had team talks on ADHD, on borderline personality disorder, but essentially what Team Talk is, it's our opportunity to talk to the experts. Because even though I've been reviewing this for 20 years, I by no means know everything that there is to know about eating disorders. And so what we do is we look at the factors that may influence your recovery, and then we pull in an expert and we pick their brain and we ask them the questions that we're curious about, and ways that we can potentially work these things to be more of a strength in our life. So today we have my good friend, Dr. Terry Hagan. And Dr. Terry Hagan is very smart. He has a psychiatry practice in my hometown where I was born in Louisville, Kentucky. Dr. Hagan started off as a neurosurgeon and then decided it was more the brain and the emotions and the interactions that he was more curious about and more passionate about. And now what he does is he kind of integrates the whole picture. So now he looks at the physical body, but he also looks at the emotional body so that we can heal the entire person, with foods, with potentially medicines, with potentially therapy, but more of an overarching approach to heal the whole person. So today, what we're going to talk about is anxiety. Go ahead, Terry.
Yeah, there's a missing word in that, if I may. The missing word is psychiatry. So I am currently a psychiatrist. I've been practicing psychiatry now for 15 years. So the way it sounded like a neurosurgeon just kind of took this rather unusual path forward. So yeah, no, I'm a psychiatrist.
Well, that is true. It just makes you smarter. As we always say, a psychiatrist is basically a psychologist with a medical degree. So he knows your emotions really well, and he knows your body really well, and he knows how the two interact, so that he can make you all around healthy. So that is the big difference between your typical psychologist and a psychiatrist. Psychiatrist knows more about what goes on in the body too. So yeah, but thanks for that. But today we're going to talk about anxiety. Go ahead.
Well, yeah, just to add something in. So in my psychiatry practice, having practiced for 15 years, and what I would want our listeners to be aware of is that psychiatric medicine can be very helpful. Mm-hmm. It can also be disappointing.
Yeah.
And good psychiatry involves looking not just at the medication options, but having very real expectations of the medicines and what they would do and what they won't do.
Yeah.
Because today, you're getting ready to say that today we're going to be talking about anxiety.
Yeah.
And the word expectations is a big word in that discussion. So yes, there are. I'm stealing your thunder. I apologize.
No.
But psychiatry involves looking at diet, exercise, lifestyle.
Yeah.
In order to be thorough.
Yes.
Okay, so you can go to your psychiatrist and say, I think I need to be on something. But what you're really saying is, help me figure out what's going on with me.
Yeah.
And point me in the direction. I trust you're going to point me in the direction that will be best for me over the long run.
Yes.
Not just to patch it up in the present. Yeah.
Well, okay. And that's one thing that I really appreciate about you too is, and we talk about this all the time, is it's not just let me give you a pill and now you're better. Like, and that's what we're going to talk about today. It's a lifestyle change. If you really want to get better, you can't just take a pill and okay, now I'm not anxious anymore. Like you have to focus on your entire life and reordering things and work on the way you think and that sort of thing. So that's what I do appreciate about you, is that you're not just, oh, here's your pill, call me in a couple of weeks, because a lot of doctors do that, oh, you have high blood pressure, here's your pill. You have high cholesterol, here's your pill. Oh, you have anxiety, here's your pill. Can't sleep, here's your pill. And what I do like is that you look at the whole picture.
Okay. Now, if I may,
Yeah, go ahead.
lest we throw the medical profession under the bus, um, when people go to see a doctor for blood pressure or
Yeah,
anxiety or
yeah,
some other problem, the vast majority of patients want that quick fix.
yeah,
They just want something easy
yeah,
that they can change in
yeah,
order to, and so if we use high blood pressure as an example, you can take a blood pressure medication
uh-huh,
and you can lose weight and exercise and start eating all the right foods and treat your blood pressure.
yeah,
Okay. Now, your family doctor actually does know that,
uh,
but patients don't want to hear it.
yeah,
And I know that sounds harsh,
yeah,
but your average patient doesn't want a lecture about what, the diet and exercise.
yeah, yeah,
Even though the more medicine advances, the more civilization advances,
yeah,
we're learning that there are right ways to think about these things that may include medication.
yeah,
But so I would be the first to throw the medical profession under the bus over an issue like this.
yeah,
Okay, but as a doctor, I also know that other side of it,
yeah,
that doctors get conditioned over time not to waste their time explaining things and teaching things that the
yeah,
patient really doesn't want to hear or
yeah,
isn't ready for,
yeah,
or maybe the patient is just sick and doesn't feel like listening. They
yeah,
just want to be treated. So I think there's this emerging area of medicine that I'm really interested in, which you call holistic,
yeah,
and holistic is a word that has lots of definitions. But I like to think that when we bring that holistic element into the
yeah,
practice of medicine, that what we're really talking about is that there are right ways
yeah,
to think about these
yeah,
things. And not that I am broken, what medication can I take to fix it,
yeah.
but rather what is truly healthy.
Yeah. Well, and there are medications that, like insulin that you may have to take for the rest of your life. But typically speaking, I would say that medication is more of a band-aid. Like it may help in the interim, but if you really want to heal yourself, you have to work on all of the components that are feeding it. Like even blood pressure medicine, it may bring your blood pressure down, but it's not fixing the root of the problem. And so
Maybe.
that's what's beautiful about therapy is therapy tends to get more to the root of the problem and go, okay, let's not just medicate you. Let's get to the root of the problem. Let's figure those things out.
Okay, and so we also want to be careful there not to get into either this or that
Yeah,
conversation. Because with me, for instance, high blood pressure runs in my family.
yeah,
There is a condition
yeah,
called essential hypertension.
yeah,
I've been on blood pressure medicine since I was in my 30s.
yeah,
All right. Now, I wonder if it runs in my family because we have a vulnerability in that area and because nobody for generations has done healthy diet
yeah,
and exercise that it would
yeah,
take to regulate the blood pressure. So
yeah,
I wonder, for instance,
yeah,
if I were to go back to being as healthy as I was when I was in medical
yeah.
school, and frankly, I didn't have enough money to eat too much.
Yeah.
I remember thinking, okay, I can't eat very much because then I'm going to run out of money.
Ramen
Uh,
noodles.
but I was playing racquetball and tennis
Yeah, yeah,
and I was in the best health of my life. Now, had I continued that into my 30s
yeah,
and 40s and 50s, would I have ever triggered that essential hypertension for which I
yeah,
started medication
yeah,
in my 30s? All right. So from now, I mean, for the person who's older and is thinking, so you're telling me that if I do diet and exercise exactly right, I won't need to take blood pressure medicine? Not so fast. You
yeah.
may still need
Maybe.
blood pressure medicine because you
Yeah,
may have a problem
yeah,
that would be there anyway.
yeah,
It's like the insulin argument. If you've got type 1 diabetes, you need insulin.
yeah,
That's not something that you're going to address with diet and exercise alone.
Yeah. Well, and it's
But
interesting that you
but
bring up.
you can still do the best you can by accounting for all of these areas, including the idea that maybe I can be on less medicine.
Yeah.
And so that's my current goal. How healthy can
Yeah.
I get? And can
Yeah.
I get down off of or at lower doses of blood pressure medicine and maybe off of them completely?
Yeah.
That's
Yeah.
not an impossibility. Part of me wants to give that a try and
Yeah.
see if I can pull that off.
Yeah.
But
Well,
I'm
it's
just
interesting when you bring up genetics because even with anxiety, they've shown with rats that you can, subject a rat to high stress environment, and generations later, there is still a genetic vulnerability.
yes.
Like Holocaust survivors and that sort of thing. Like my mom, high anxiety. And I look at the people in my family, and they have issues with anxiety too. So that does make you more vulnerable to it. But
Yes.
what's nice is the more you learn, and the more techniques you learn, and the more you learn about yourself, the more you learn that, hey, just because I'm vulnerable to it, like you're saying with blood pressure, just because I'm vulnerable to it doesn't mean that I need to exhibit it. It's that whole epigenetics thing. Like genetically, you may have a predisposition or a vulnerability, but how I treat my body and how I train my mind and all of this can determine whether or not I am anxious, whether or not I demonstrate anxiety.
Or yes, agree with all that. Again, add an element of degree.
Uh-huh.
Okay.
Yeah. Yeah.
So, I talk to people about regulating anxiety. I'll
Yeah.
say something like, I can probably get your anxiety down by about half with medication. The other half you would learn to regulate in your therapy.
Yeah.
Meaning you go to therapy, you learn those cognitive things. And yes, I believe the cognitive behavior therapy is the best treatment for generalized anxiety.
Yeah.
Um, and so when a lot of therapists will work on coping skills,
Yeah.
I believe that cognitive work is actually more beneficial, and the evidence seems to say that, or I wouldn't be saying that.
Yeah.
um, but it's relative, and so uh, people, as you have very nicely pointed out, there is the genetic potential that can be brought out by life circumstances.
Mhm.
And so
Yeah.
somebody, for instance, who already had this obvious example, somebody might be a little bit anxious, a little bit nervous, and then a major trauma hits.
Yeah. Yeah.
And they're going to have PTSD
Yeah.
that's much greater than the person who didn't have that genetic predisposition.
Yeah.
Okay. So the environment will affect people in different ways depending upon what their baseline
Yeah.
genetic makeup is.
Yeah. Well, and it's interesting because I do see people that it seems like no matter what you throw at them, it just rolls right off their back.
Mhm.
Like they don't even notice it. And I always envy those people because I'm one of those people that,
Yeah.
oftentimes something will happen and then I play it over and over and over in my brain. And then it just becomes bigger and bigger and bigger. And so like when you have a person that comes in and their anxiety is basically caused because I just can't let stuff go. Like
Yeah.
what kind of advice would you give a person like that?
Well, again, when I hear that, I'm hearing ADHD, and we talked about
Yeah.
that a couple of weeks
Yeah.
ago. That hyper focus
Yeah.
and the hyperactivity of the brain can cause something to escalate, and then you can't let it go. So the
Yeah.
words obsessive and manic even have been used to try to explain that, but it's really an ADHD brain that is getting overwhelmed, and it's like it's a feedback loop that
Ah,
something makes the patient anxious. The anxiety causes the ADD to momentarily get worse, meaning you
huh.
feel scattered and overwhelmed, and so then you feel even more anxious, and then it escalates. Okay.
Yeah.
If we take ADD then out of the discussion, it is the case that somebody who's anxious is, so let's define generalized anxiety disorder.
Mhm.
All right. So that diagnosis is mostly embodied by the concept of excessive worry.
Yeah.
So then the question, well, what makes it, what is the excessive part,
Yeah.
or the excessive degree? Well, the excessive degree would be, I'm having panic attacks, I can't sleep, I'm snapping, I'm blowing up my relationships, uh, people, it's like the rubber band that gets stretched so far that the slightest additional stress will cause it to snap. And
Yeah.
so that's the anxiety associated with stress. But if you superimpose that upon somebody who already is a worrier,
Yeah.
again, we get back to the excessive part. So generalized anxiety disorder means that under normal circumstances, I'm not talking about high stress or trauma, but under normal circumstances, uh, that patient is worrying too much,
Yeah.
too much.
Yeah.
So again, we can tone that down with medication, but if that person will then get into therapy and learn what's going on with me,
Yeah.
and how do I understand it better, and how do I regulate it downwards.
Yeah.
It isn't about coping with the next thing that might come up, although coping skills does have an important part in the conversation, but it's really more a matter of what am I thinking
Yeah.
that is causing my anxiety to go through the roof? Is
Yeah.
it generating irrational fear? The word irrational means unreasonable or
Yeah.
not realistic. So if in your cognitive therapy you identify the thought that is generating that irrational fear, and you examine that, look at it, be
Yeah.
aware of it, and then consider, okay, but what would the normal counterpart to that be, or what would a more accurate way of looking at it? Let's say, I'm afraid of catching a dreaded disease. Well, what are the chances
Yeah.
of that? If you
Yeah.
look at the evidence or the statistical probability that that would happen, notice you're applying an intellectual evaluation to it as opposed to an irrational fear about it.
So you're basically redefining the threat.
You're
Is
taking
this
what's
really a
irrational,
threat, or is this?
yes, and you're taking what is irrational and emotional, and you're making yourself apply an intellectual interpretation and an intellectual evaluation of what is really going on,
Yeah. Yeah.
such that the intellectual decisions that flow from that work better for you than being over here where you're reacting to fear
Yeah. Yeah.
because you don't know any better. You
Yeah.
see, so you get into therapy, you learn how this works,
Yeah.
and that's how you learn. I, um, I have um, I have, in my most recent experience, two patients that were so anxious that I would just, you know, trying to get to a better place with medication wasn't working.
Yeah.
And somehow with one of them who was in her 70s, we were working so hard to get her medicine right, and then it dawned. I felt so inadequate. But it dawned on me one day, why do I not have her in therapy? I
Uh-huh.
have a cognitive therapist right here in my office.
Yeah.
Nobody's perfect, and that's one of those things that
Yeah.
I didn't see. And so then once I did see it, I put her with this young woman who's a cognitive therapist. And a few weeks later, the patient's calmed down. I'm feeling better now, she's saying. And
Yeah.
and 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 why are you feeling better? Well, that girl you wanted me to see, she's so sweet. She got me to thinking about it differently, and
Yeah.
that's helping.
Yeah. Yeah.
Yeah, that's how it works.
Yeah.
So, if I may, at this point, there's no substitute for self-education. And in this case, you're going to therapy to learn, but don't think that the therapist is like a school teacher who's going to teach you everything you need to know. And instead, do the online research. Patients are embarrassed sometimes that they went online and found out some things, and now they have questions. And I'm thinking, don't be embarrassed by that. In an information age where you're becoming an expert on your problem, good for you.
Yeah.
That means that when we get together to talk, that our conversations are going to be more productive and at a higher level than they would be if you weren't self-educating.
Yeah.
Become an expert on your problem in that rather proactive way.
Yeah. Well, because then it becomes more of an empowering event, because you don't want to be reliant on a therapist for the rest of your life. And so and sometimes, unless you tell your therapist, they may not know that certain things are going on with you. So the more research you do, you go, ooh, that's kind of an issue with me. Maybe that's something I should talk about, with my therapist. Yeah. No, that's interesting, because I'll be honest, that was exactly how I transitioned. And I was embarrassed, I mean, like, I was a psychologist. I had issues, and I did feel embarrassed, because I'm like, I don't mean to insult you, and please, don't be like, oh great, she's one of those that went and Googled something and now she wants to, bring it to the doctor, But what I really appreciated was that my therapist was like, no, I think it's great that you have all this education, and we can speak intelligently about what's going on with you, because it makes my work so much easier. And it doesn't drag it out, me trying to drag out your symptoms and in all of this. So it really does help to self-educate. Yeah. Well, you brought up generalized anxiety disorder. So what other types of anxiety issues do you see in your practice?
All right. Yes. So we could jump right into PTSD and social phobia and the like, but what I want to talk about more than that.
Okay, perfect.
I'm generating this series of videos that I call a Society of Anxiety.
Yeah.
And the concept starts with, we live in a very stressful society.
Yeah.
And we are stressed by the expectations that we have on ourselves, ourselves, and the expectations that other people have of us, or the expectations that we think other people have of us.
Yeah.
And all the expectations tend to result in a lot of anxiety. And the term wound up tight. Comes
like I have to look like Ken and Barbie.
Yeah, that's a good one. That's a very good one, because of the implications for eating disorder.
Yeah.
So you ask me, what do I see most often? I see a lot of ADHD.
Yeah.
But I see a lot of people who are stressed to the max.
Oh yeah. Yeah.
To the point where they think, I need to go see somebody.
Yeah.
All right. What they're really saying is, I don't know how to think about this.
Yeah.
But this doctor over here, he sounds like somebody I might want to talk to. So then we start that conversation, and that's normally how I started. I don't know how many times I say, we live in a very stressful society. Let's talk about that as a starting point, because you're telling me you can't sleep, or you're telling me you're having panic attacks 2 or 3 times a week. And so it's all in that context. So the answer to your question is adjustment disorder with anxiety. So the term adjustment disorder implies that there's not a true mental illness going on here. What it is there's something that you're having trouble adjusting to.
Yeah.
And your anxiety is the predominant symptom.
Yeah.
So you can have adjustment disorder with depression, adjustment disorder with disturbance of emotions and conduct.
Yeah.
There are variations on adjustment disorder, but adjustment disorder with anxiety is probably the best diagnosis to describe what people are going through when they're stressed too much. Now, there are diagnoses of acute stress disorder, which is an anxiety disorder. And acute stress disorder blends with acute post-traumatic stress disorder and chronic post-traumatic stress disorder. Backing up, acute stress disorder means usually onset within a month.
Got it.
And kind of time limited normally, because if it goes on too long, it becomes PTSD.
Okay. Excellent. Well, and I know, like, with our audience, like, some of the things when you talk about phobias, you know, there's the, you know, the phobia that, oh my God, if I eat something, I'm going to get fat, or this particular food, I'm afraid of this food, you know, and what it'll do if I eat this food, or any food. So if you were to see a patient with these types of phobias, like, how do you relieve that anxiety?
Well, the phobias are best addressed with cognitive and behavioral therapy. A phobia is more specific
Mm-hmm.
than generalized anxiety. But I may have somebody with a generalized anxiety disorder who regulates it pretty well, unless she flies a couple of times a year.
Yeah.
And so then she might say or ask me, can I have something just for those moments?
Yeah.
And then, yes, there's a medication for that. That's appropriate.
Yeah.
I mean, why would you have to be miserable,
Yeah.
flying across the country because your anxiety is so high that you can't stand it? Or you don't go, you avoid the
Yeah.
anxiety by staying home.
Yeah.
And taking a medicine a couple of times a year is not going to get you hooked on it.
Yeah.
So
Well, and when you talk about social anxiety, you know, that may be part of it too. Like, hey, when I get into crowds, I don't like the crowd. It makes me anxious. Or with people with eating disorders, a lot of it is, I don't want someone to see me eat, or I don't want them, you know, I don't want to potentially eat in a way that they're going to judge me, or, you know, so a lot of that social anxiety will build up because they feel like they're being judged, or they're not going to do something right. And so to avoid that, they just start to isolate themselves.
Right. Right. So that again is a good description of social anxiety disorder or social phobia, whereby being out of the house in crowds
Yeah.
is anxiety provoking in and of itself. Cognitively, what's going on there is people feel scrutinized. They feel like people are looking at them, evaluating them, judging them, and they feel very uncomfortable with that. So again, in therapy, you can raise the question: are they really doing that? So there are a couple of rules that I learned when I was in my early 30s that were very helpful for me. One of them was, people don't think about you as much as you think they do.
Yeah. Yeah.
So in a social phobia situation, that applies. People are not thinking about you; they're living their own lives. You're
Yeah.
just another person in the crowd.
Yeah.
And so then you learn that, okay, if I'm going to be out in a crowd and that thought starts to happen to me again, that everybody's watching me. No, they're not. They
Yeah.
don't care about you.
Yeah.
And that's the second rule. The other rule was, Terry, not everybody likes you.
Yeah. Yeah.
And
Not
that
everybody
needs to
cares
be
what's going on
okay.
in your life.
Uh, and that needs to be okay, because you can't expect everybody in the
Yeah.
world to like you.
Yeah.
Some will, some won't. There are
Yeah.
different types of people out
Yeah.
there. And again, some will, some won't. So when you set yourself up for, I'm in a crowd of people, everybody needs to like me, or there's something wrong.
Yeah.
No, sorry, dear. That's
Yeah.
just, I say dear, I don't mean to be sexist there,
Oh,
because
yeah,
you're
no.
a man as well. But no, sorry, that's not reality.
Yeah.
You've got a thought there that is
Yeah.
generating an irrational fear, and you want to examine that,
Yeah.
because then the next time you're out in public, when you start to have that thought, now you have the awareness of knowing, okay,
Yeah.
then that's not what I want.
Yeah.
Now, what was that other thought we talked about in my therapy? The other thought
Yeah.
was, right, people are not watching me. They
Yeah.
don't care about me.
Yeah. Well, and
Yeah.
sometimes it's being more choosy about who you hang out with. Sometimes we try to fit into the wrong crowds, and of course that's going to cause some anxiety.
Yeah. Well, okay. So a good point there that, we can define these psychiatric diagnoses,
Yeah,
but oftentimes they are also, excuse me, excuse me, also they're on the backdrop
yeah,
of issues,
yeah,
the trauma issues, the dysfunctional family issues, the alcoholic family issues, the abusive issues. Um, those are in the background, and those are the very things that you used the term epigenetic earlier. Those are the very things that might have taken this vulnerability and made it to be
yeah,
much bigger than it might have been.
yeah,
So in your therapy, then you're going to seek to understand, how did I get to be this way? I
yeah,
mean,
yeah,
yeah, it's genetic, but there's more going on here.
yeah,
And the more that you learn, frankly, you know, I was a neurosurgeon, and I got into therapy on the recommendation of a friend who
yeah,
saw the same issues in me that she had dealt with in her
yeah,
family, and she had gone to therapy, and it was the best thing she ever did. I know that sounds like an advertisement for psychotherapy, but I did that in my early 30s. I saw a psychologist for a year, and a couple of years went by, and then I saw another counselor for a couple of years. And then another couple of years went by, and then I started seeing a psychiatrist who does therapy, and I started thinking, after seeing him, I thought, well, you're an MD, same as I am, and
yeah,
I actually enjoy what I'm doing with you more
yeah,
than I enjoy practicing neurosurgery. Which, people ask me, why would you make that change? Well, my neurosurgery practice had settled into a practice of taking care of back pain,
yeah,
and it wasn't but even then, had I gone the other direction and been doing more brain surgery, that still would not have been as gratifying for me
yeah, yeah,
as that process of looking at my issues, understanding how they work, being absolutely fascinated
yeah,
by this fund of information that
yeah,
I didn't know anything about until I went into therapy. And so then I like to talk about self-improvement over the years, because we're all growing and improving, or wanting to improve toward that ideal version or vision that we have of ourselves. And so therapy is a way to accelerate that growth.
yeah,
So for people who settle into therapy for a while, well, that's what I did, and
yeah,
that's what I really appreciate, because those are the people who are like, yeah, I'm going to spend the time and the money for me, to
yeah,
work on me,
yeah,
so I can understand me, and so I can be happier.
yeah,
It's not
yeah.
selfish. It is
No,
not
no,
selfish, and you don't need anybody else's approval.
yeah,
Actually, you may want the approval of your husband, or whoever else is on your support team, but in another sense, you don't need it.
yeah.
That's
Well, and
another
the thing is, we
conversation.
can show up so much better for people when we are the best versions of ourselves. But when
Yeah,
we're struggling, it's like on the airplane where they say, put your mask on first so that you can help other people. You're like, I can't help anybody if I'm not taking care of myself. So it's not selfish, because it is so that you can be a more productive person in your own life and in your community and your family. And I'll just use this as an example. So once I started to look at my anxiety, and I love my mom, and I know my mom is going to watch this. But my mom has a lot of issues with anxiety, and she's very much a worrier. A lot of that has to do with the way she grew up. um, but I found myself avoiding talking to my mother, because I would bring up something that was small, and next thing I know, I'm getting well, what if this happens, and what if that happens, and next thing I know, this one little thing now has like 100 different things. And then I'm getting constant, like, oh, have you done this? Have you done that? And it was making me so anxious that I couldn't call home. And so, but once I realized this, and I could put boundaries, And I could say, like, let's not what if it. Let's worry about what is here, what is actually in front of me. Like, our relationship started to grow because, we were talking more, it was more productive, but it was all about setting those boundaries and going, no, I can't take that energy because it's making me anxious. And so it was amazing how once I was better, I was able to show up better for my mom. And even by having that discussion, it's something sometimes if you're a worrier, you don't realize that you worry about everything. But when people start to say, hey, that hasn't happened, let's not worry about things that don't happen, then you start to put it in a perspective. And so I was able to have a better relationship with my mom. I was able to be a better daughter. So when we're talking about therapy is like, I want to show up better for everybody, including me. So yeah.
Well, I will tell you that I'm really grateful to know what I know as a psychiatrist.
Yeah. Yeah.
As a neurosurgeon, I look back on my personality and I don't like what I see.
Yeah.
I don't like that version of me
Yeah.
20 years ago,
Yeah.
30 years ago.
Yeah.
People who would get to know me after a while would say, my first impression of you was that you were reserved, aloof, and hard to get to know.
Yeah.
Well, I'm grateful for the therapy I've had. I'm grateful to be a psychiatrist because I get to live in this world where we talk about these things.
Yeah.
I'm so much happier now.
Yeah.
And my personality is kind of, well, let's just say it's not what it was.
Yeah.
Neurosurgeons take themselves too seriously. Well, I take things pretty seriously when I should, but at other times, yeah, I'm just happy.
Yeah.
And the point is to kind of be a role model in the sense that that I think this idea that I just want to be happy, it can sound like an immature or it's something
Yeah.
along those lines. But there is a lot of importance in that because, as you said, you can't help anybody else if you're
Yeah.
not happy with who you are and what
Yeah.
you're about. But more importantly, in the I think that the part of loving your neighbor is also, it's that concept that when you smile at someone, you brighten their day.
Yeah.
And I like to think in terms of improving
Yeah.
the world one smile at a time.
Yeah.
It is about being happy. I just want to be happy. Well, I want to be happy and I want a whole lot of other things.
Yeah.
So be careful about the just part. But there's nothing wrong with wanting to be happier
Yeah.
and to figure yourself out and 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 then in a discussion about anxiety, it's that very process that settles you down a little bit. It's like, yeah, okay, I'm working on myself. I'm doing the best I can,
Yeah.
given what I have to work with, and I choose to take what I'm working with and analyze it and improve it. And my therapist helps with some of that.
Yeah. Yeah. But that's a key point that you bring up, though, is just that cognitive shift into I'm doing the best I can. Not I have to do better, not they have to do better. We're all doing the best that we can. And just that cognitive shift into hey, we're all doing the best we can. I think even implanting that thought brings down a lot of the anxiety.
Yeah, it does. Because and what you just alluded to, you wanted to do a special session on perfectionism. So I mentioned that I saw a psychologist for a year. This goes back to when I was 31 years old. And after talking with me for about 3 months, he said, "Okay, let me kind of pull some things together for you. In ways he's a really good father. In other ways, he's alcohol use. And
wait, hold on, back up just a little bit. So back up to the part where you were talking about your friend.
my friend or
Yeah.
my psychologist?
Your psychologist.
Okay. All right. So this goes back to when I was about 31 years old, and I saw this psychologist for about a year. And after about 3 months, he said, okay, let me pull some things together here. So, you know, this picture that's formed is that you're the oldest son in a family. Your father's a doctor. He's a good father, good doctor, but he drinks too much every night. And in his drinking, he is very critical of everyone. And in his parenting of you, what happens is that we're having some issues.
It's
You
because
keep freezing up.
my phone keeps ringing. That's why it cuts off my internet. Okay, so go back to the part about your father. So your
Okay, would it be reasonable to turn off your phone until?
well, so the problem is I use it as my hotspot. And
Oh,
so
okay.
yeah.
All right.
Yeah,
Okay.
sorry.
So
But
what you,
I'll edit this out later.
sure. Okay. All right. So the problem in his parenting is that when you achieve something, then it's like good job, but the very next words out of his mouth are, how could you have done it better?
Yeah. Yeah.
And what's next?
Yeah. Yeah.
So you're never allowed to really savor
Yeah.
a victory.
Yeah.
And so there was a time, again, at about 3 months that I had been in my neurosurgery practice for about a year. And our accountant there were two of us who started the practice together. Our accountant had shown us our numbers for the first year, and they looked really good. And I
Yeah.
was proud of that achievement. And so I went home and told my parents about it. My parents lived about 100 miles away, and so I was visiting them, I think, for Thanksgiving weekend. And so I shared that information with them, and they were, that was positive. And then the next thing my father said was to talk about his medical school class reunion that he had been to recently. And he ran into one of his classmates, a neurologist that I also knew and worked with. And so he said, do you know that he runs 5 miles a day? And you see, my father had polio when he was 15, so he walked on crutches, and so that may be an important part of the story. But he said, do you know that he runs 5 miles a day, and he looks so successful? He said, maybe if you were to lose 20 pounds and run 5 miles a day, you'd be even more successful.
Yeah. Yeah. Yeah.
And this time I said to him, I said, nothing's ever good enough for you, is it?
Yeah.
I had learned that in my therapy because my therapist had explained it to me this way. Your father set the bar at perfection. He essentially, without realizing it, sent you messages over and over again that said that nothing less than perfection was going to be good enough.
Yeah.
So every time you set a goal, you set it at perfection. And then
Yeah.
I got news for you. Nobody's perfect.
Yeah.
So he said, what happens is you set your sights at perfection, and then you always fall short because you're only human. But then you interpret that falling short as a failure
Yeah.
or an inadequacy.
Yeah.
So then everything in your life that you interpret that way becomes evidence to you of how inadequate you are.
Yeah.
So it highlights the damage that perfectionism can do. And in fact, you're damaging yourself over and over again, because if nothing less than perfect, if anything less than perfect is a failure
Yeah.
or an inadequacy, and evidence that that's true. I mean, I tell my patients, it's not true. It
Yeah.
is not true that you're fundamentally inadequate.
Yeah.
You know, it is as if you're living a lie.
Yeah.
Somewhere along the way, you were taught to believe that you're inadequate, that there's something fundamentally wrong with you.
Yeah.
That's not that's not true.
Yeah.
What is true is that you're imperfect. You're
Yeah.
human. You know, nobody is perfect.
Yeah. Well, and let's be honest, there's always more you can do. Even if you did an outstanding job, you're like, well, but I could have done this and I could have done that. Yeah, you could have, but sometimes good enough has to be good enough. You know, and you were absolutely right. I love the point you made about stopping to celebrate your successes. You know, because we do, it's like we've done something brilliant and then we move on to our next brilliant move without even celebrating the first brilliant move. You know, and it doesn't have to be anything huge, you know, and you know, for our eating disorder people, it could be, you know what, today I didn't purge. You know, take a second just to go, you know, okay, yes, I'm not perfect, I'm still binging or I'm still doing whatever, but today I didn't purge. You know, or this meal I didn't purge.
So what my psychologist said to me after all that, he said you would be a whole lot happier thinking about what degree of imperfection you're going to settle for.
Yeah. Yeah.
Because he said it's not fair for your father or for you to
Yeah.
tell you that your best is not good enough.
Yeah.
Your best has to be good enough. It's the
Yeah.
best you can do.
Yeah.
It has to be good enough. And so that was the single most important piece of information that I would think about for many years after that. I know
Yeah.
that sounds dramatic, but it was like it was that
Yeah.
turning point.
Yeah.
Because after that, anything that I did that was less than perfect, I was able to say to myself, well, it was the best I could do.
Yeah. Yeah.
Because I know I'm doing my best all the
Yeah.
time. Here's the rule. We're all doing the best we can given what we have to work with.
Yeah.
And sometimes what we're working with is what our parents gave us.
Yeah.
And they may have given us this belief that we're fundamentally inadequate.
Yeah.
And so nobody had perfect parents either. That's another
Yeah.
rule.
Oh, yeah.
So as an adult, you've got to take what you were given
Yeah.
and make the best of it, and understanding this concept of we're all doing the best we can, nobody's perfect, and I'm not going to set myself
Yeah.
up for that. That's really, really valuable stuff.
Yeah. Well, and
Really,
sometimes we're juggling so much that you go, okay, good enough has to be good enough in this, that, you know, like there can't be perfection in all of this. And, you know, and when you brought up ADHD, that's one thing I thought about is sometimes with ADHD, you know, you'll take on so many projects because, oh, shiny thing, you know, like, oh, that looks interesting. And next thing you know, you've piled so much on yourself. And then you have this level of perfection that you want it done at. And you're like, this is just not realistic. If either I need to drop some balls and go, okay, what's important? Let's put some of these balls down. I'm not going to touch them, or I'm going to touch them later. Or, you know, we need to go, okay, good enough is going to have to be good enough. You know, it's done.
so when anxiety is running high, it is often because you got too much on your plate.
Yeah.
You've taken on too much.
Yeah.
You're overwhelmed.
Yeah.
And that happens to me on a regular basis.
Yeah.
And it's like today. Today, I've got this ambition today that I've got to go back and redo all my goals that have to do with my media company and my psychiatry practice.
Yeah.
Because I've set that goal for this weekend. All right. But the reason for that is I need to get my anxiety down by getting better organized.
Yeah.
All right. Notice I need to do that.
Yeah.
So the concept that I really wanted to get to here is that each of us is the captain of his or her own ship.
Yes.
You've got to be that person in your life who decides what's best for you.
Yeah.
And in a discussion about perfectionism and feelings of inadequacy, you take charge of that.
Yeah.
You have to be the person to sit and think and decide, what do I want? What do I want to do?
Yeah.
Not what is expected of me.
Yes.
That's
Yeah.
in there, but it's not the main thing. The main thing is what is reasonable for me to expect of myself.
Yeah. Yeah.
Reasonable.
Yeah.
Reasonable, rational, and intellectual. Instead of going with your feelings, because the feelings tell you how to think about your life, it's the opposite.
Yeah.
Your feelings are sources of information, but
Yeah.
how you think your way through life is the way you get your life to do what you want it to do.
Yeah.
And that lowers your anxiety. That perspective
Yeah.
is really helpful. Okay. This morning, I wanted to just mention this. You and I are doing this recording. You're in Germany, I'm here in the US, and there's a time difference. Well, neither one of us can remember what the time difference is
Yes.
because time changes over here, doesn't change over
Yeah.
there. And so we got mixed up with that this morning. All right. Nevertheless, my plan was to wake up 2 hours early.
Yeah.
I was going to wake up at 5. We were going to do this recording at 7. All
Yeah.
right. Well, at 5 o'clock, I'm getting these texts from you. Wake up, time to go. And
Yeah.
wait a minute. It's only 5 o'clock here. Okay. So after that, I was aware. I got up. I drank my coffee for an hour. I
Yeah.
still had a shower, and I thought, I could, knowing that Kim is ready to go with this, I could allow some
Yeah.
imagined expectation
Yes.
to change the way
Yes.
I do my morning.
Yeah.
All right. But the reason I wake up at 5 o'clock in the morning and drink my coffee is so I can sit and drink my coffee and not have anything else that I'm expected to
Yeah.
do.
Yeah. It's you time.
Yes. And
Yeah.
it's
Get your
thinking
brain
time.
centered. Yeah.
It's thinking time. It's time that my mind is on whatever seems to be the front burner issue of the moment.
Yeah.
It is. So we live in a very stressful society where people's anxiety, yada, yada, yada. What do you do with that? You
Yeah.
do the opposite.
Yeah.
So I've recorded some videos sitting at the beach. Okay.
Yes.
And what I talk about, we live in a very stressful society. And so the opposite of that stress that we put on ourselves is being on the beach.
Yeah.
That's why we
Yeah.
go to the beach. We go
Yeah.
to the beach to do the
Yeah.
opposite.
Yeah.
And so given that we all can't go to the beach every day, we can still think about what would the opposite of this stress be,
Yeah.
because I need some of that in my life. I need enough of that in my life that I'm balanced. I can
Yeah.
handle the stress, but I'm happy because
Yeah.
it's balanced out.
Yeah.
I'm happy in my relationships because I'm not snapping all the time.
Yeah.
Or I'm happy because I'm sleeping pretty well.
Yeah. Yeah.
I'm not sleep deprived. I'm not stressed out because I've told myself I can get by with 5 hours of sleep every night. That's what I need to do. I can do that. No, you will not get away with it.
Yeah.
We need 8 hours of sleep at night.
Yeah.
You haven't regulated your life in such a way as to make that happen. Consider a self-improvement plan.
Yeah.
You get to do that, and maybe you need to get the cooperation of other people to do that, but it is normal stuff we're talking about.
Yeah.
These high expectations and telling yourself I can get by on 5 hours of sleep, you won't get away with it.
Oh yeah. Yeah. Well, and since you brought up sleep, I definitely want to talk about sleep, because that was one thing I really had a lot of problems with. Like, I would literally lay in bed and my brain would just be going 1,000 miles an hour, and then I couldn't get sleep. So, are there any recommendations, to how do you turn that down so that, you can just go to sleep?
Well, we could go on for another hour
Yeah.
about basic sleep hygiene, we call
Yes.
it.
Yeah. Yeah.
Sleep hygiene is a term we use to say that there are certain clean ways. We think about
Yeah.
physical hygiene as a matter of staying clean or clean enough. and then sleep hygiene is a matter of going about sleep in a clean way.
Yeah.
And there's a knowledge to it. Okay, so if you want to get better, what you do is you go online and you look at, how to sleep better, and you'll run into these rather basic discussions.
Yeah.
All right. So it has to do with accepting that you do need 8 hours of sleep.
Yeah.
And so if you're lying there and your mind won't seem to let you sleep, what do you do with that? Okay. You look at the food you're eating.
Yeah.
Maybe you're eating foods that are causing your system to be in a heightened state of alert.
Yeah.
And I know that sounds dramatic, but the standard American diet
Yeah.
is one in which your body is constantly
Yeah.
fighting off
Yeah.
the stuff that you put in your body that's not nutritious. Your body has to deal with it. Your kidneys have to deal with it. Your immune system has to deal with it. Your brain is affected by it, and people don't know that, but it's a very real thing. And so, when in a conversation about sleep, it starts with what food are you eating,
Yeah.
and then activity levels. Now, we could talk about exercise.
Yeah.
People hate to exercise, but there are two sleep drives to talk about in this conversation. One is what we call the diurnal rhythm. Your
Yeah.
brain wants you to be sleeping when it's dark outside
Yeah.
and awake when it's light outside. And so if you don't have anything in your life that's stressing you out, anxiety,
Yeah.
then you're going to settle into a sleep pattern in which you're going to sleep during the dark, and you're going to sleep for about 8 hours
Yeah.
before you wake up naturally, and your brain is going to have a tendency to want to do that at the same time
Yeah.
every 24 hours. Now, you either allow that to happen or you mess it up.
Yeah.
You can mess it up with work, you can mess it up with stress, all
Yeah.
right? And you can mess it up with having so much on your plate. You can have so much on your plate that you got your mind is just thinking about too much.
Yeah. I
Yeah,
had to start
I had
keeping
a,
a journal by my bed, because that was one thing is, oh, tomorrow I have to do this and that and that. So I had to like literally just turn on the light, write it all down, and then go back to sleep.
let's look at what you're doing there. All right. What your mind is working on something during the night that it didn't have time to work on during the day.
Yeah.
Which can easily mean you got too much on your mind.
Yeah.
I had the occasion recently, and I talked with friends of mine about it. In like a 3-day period, I took the wrong exit twice. Now I'm driving, I'm on a local interstate, and I take an exit I did not intend to take twice.
Yeah.
And I thought, okay, dementia, is that what we're looking at? The earliest signs of dementia? But the feedback I got when I talked about it was, you got too much on your mind right
Yeah.
now.
Yeah.
So the same thing that would make you make those mistakes will also keep you awake at night.
Yeah.
So it
Yeah.
gets back to that you got to have a balance. If you think you are expected to do all of this
Oh,
stuff
yeah.
and then you can't sleep
Yeah.
and you can't get along, you're defending all this with the person that you love the most.
Yeah.
People say, I had a fight with my wife last night. Why would you do that?
Yeah.
Why would you fight the person that you love more than that you
Yeah.
say you love more than anybody else, and the person you want to love you and you're fighting her?
Yeah.
Well, that's normal. All couples fight. All couples may fight,
Yeah.
but the point is it's not normal.
Yeah.
You damage the relationship every time you do that.
Yeah.
And then you've got another problem
Yeah.
that's going to keep you awake at night.
Yeah. Yeah.
You
Well,
got to
and what?
stop and think. You got to drink your coffee and stare out the window
Yeah.
or do something that's the opposite of the stress
Yeah.
so that you become balanced. And you do that on a regular basis. I do that practically every morning.
Yeah.
And some would say, well, that's a waste of time. No, it's not.
Oh, yeah.
No, that's the time I need to regulate myself,
Yeah.
to balance myself out,
Yeah.
to think about what I really want.
Yeah. Well, and I also find that if I get myself into routines, that it's less that I have to think about. So like now I have a wind down routine where I go, okay, 2 hours before it's time to go to bed, I start turning the TV off, I start turning the electronics off, because of the blue light. But and
Yeah,
then
yeah.
I'm like, okay, well, do I want to take a bath, or do I, but one thing I really like is meditation, but the
Mhm.
guided meditation, just so it kind of brings your brain, your brain waves
Yeah.
down into the calming, ready for bed brain waves. Yeah, but yeah,
Well,
it's
that's how you should think about
yeah,
your sleep. What is my
yeah,
bedtime routine?
yeah,
What habits do I have in place that work for me?
yeah,
And 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 if they're not working, it isn't because you don't just throw them out and try something else.
yeah,
You add to
yeah,
it. If
yeah,
they're not working, it's because they are not enough.
yeah, yeah,
So maybe I need to learn a little bit more about that. Maybe I
yeah,
need to go Google that one again and think it through
yeah,
again and see if there's
yeah,
something more that I can do.
yeah. The other thing that my therapist had told me was if you're laying in bed and you're worrying and it goes on for more than about 20 minutes, actually physically get out of bed
Yeah.
and go read a book or whatever, because otherwise you train your brain that when I get in bed, this is my place to worry. This is where I figure out what I'm going to do tomorrow. This is where I worry about everything that happened today, what's going to happen tomorrow. And so that actually, I was surprised because I'm like, no, if I just lay here long enough, eventually I'll fall asleep. But it doesn't work. You just keep going over and over it. And I did find that actually getting out of bed, I would get, maybe a couple pages in, and I was out. So it was, yeah, it worked like a charm.
Well, I very much agree with that rule. You
Yeah.
know, bed is for sleep
Yeah.
and sex.
Yeah.
Uh, throw in a little sex there. But bed is for sleep. But particularly if you have a sleep problem, then what you're doing is you're conditioning yourself, as you said, for your bed to be a place of worry,
Yeah.
a place where you're thinking through things
Yeah.
that are keeping you awake.
Yeah.
So I've observed the same rule. If I've been lying there for 20 to 30 minutes and I'm still wide awake, I don't stay in bed.
Yeah.
I get up and do something.
Yeah.
And it not to say that that's easy,
Oh
because
yeah.
it can happen to a lot of people in the middle of the night. You
Yeah.
wake up at 3 o'clock in the morning and you can't get back to sleep.
Yeah.
Okay. Well, now what do? There's nothing I want to do at 3 o'clock in the morning. I don't want to read a book.
Yeah.
There's nothing on TV at 3 o'clock in the morning that I
Yeah.
want to engage with. I don't want to get into that either.
Yeah.
So I'm just asking that we keep in mind in a discussion about anxiety that if your mind is sorting through things at night,
Yeah.
then it's because you're not sorting through those
Yeah.
things during the day, and you
Yeah.
probably have too much on your mind.
Oh yeah. You just go, go, go. And then at the end of the day, you're like, okay, whew, okay, now I have time to think.
Oh, and oh, by the way, while you're doing all that, you might get up and eat something,
Yeah. Oh yeah.
because we know that a full stomach will calm you down and
Yeah.
may help you to go to sleep.
Yeah.
So is that not a form of stress eating?
Yeah. Oh, absolutely. Yeah, I'm totally guilty of that. I mean,
Yeah,
if you think about it, what we always want, because when we were babies, the milk had this perfect combination of sugar and fat. So, so what we end up craving is something that's soothing, like sugar and fat.
yeah, yeah,
Yeah.
right. So, yeah, I just wanted, I
Yeah.
just wanted to weave in the eating,
Yeah. No,
the
absolutely.
disordered eating in a
Yeah.
discussion about anxiety and stress
Yeah.
and sleep.
Yeah. Yeah.
Yeah.
So I know that we're getting to the top of the hour, but I did want to finish with one thing. And this is because, you know, we think of stress and we think of, okay, yeah, it makes me a little like disorganized and it makes me all these things. But can you just kind of wrap around the physical effects that stress has on the body?
Well, so the effect is embodied in the term chronic stress.
Yeah.
We'll call it chronic stress disorder. What actually happens is that your stress hormones go up and stay up. So
Yeah.
we're talking cortisol levels.
Yeah.
So when stress is constant, cortisol levels, for that matter, causes weight gain.
Yep.
So
Yeah.
and the chronic stress just sets in motion all these things that we've talked about
Yeah.
in a conversation about anxiety. Chronic stress is chronic anxiety,
Yeah.
and you don't just snap out of it.
Yep.
You know what you do ideally. I keep coming back to this: is you have to think your way through it. You have to sit down with the coffee and think, what's going on with me. But now be aware I may be in a chronic stress situation here,
Yeah.
because people usually underestimate the amount of stress they're under.
Yeah.
You know, they'll come to me and I say, what stress are you under right now?
Yeah.
That's the kind of reaction I get. I hadn't thought about that.
Yeah.
And so a good exercise is to write down the various things in my life that I find stressful.
Yeah.
And you may write down a list that's a whole lot longer than you thought it would be.
Yep.
And again, taking time to think about what's going on with you. And in this case, am I in a chronic stress pattern here,
Yeah.
whereby I'm living with this stress and I can't do anything about it?
Yeah.
And there are people who really are, you know, again, we're all doing the best they can, but we are all doing the best we can. And there are people who are in very stressful lifestyles. So what comes to mind is the mother who has a disabled child.
Yeah. Yeah.
That's difficult.
Caregivers. Yeah, definitely.
And or the man who has to work 3 jobs because his kids, you
Yeah.
know, he's got to pay the rent
Yeah.
and
Single
is
moms. There's
yeah,
all kinds of,
or you know, my daughter's in college, you know,
yeah.
so stuff like that, and so it is still helpful. Even though you can't do anything about some of your stresses in the moment, in the present, it is still the case that being aware of them
Yeah.
lowers your anxiety.
Yeah.
If you're able to say to yourself, I know why I am living a stressful life.
Yeah.
It's because of this and this. And these are things that I cannot do anything about right now.
Yeah.
So in the discussion of anxiety, we frequently talk about the serenity prayer.
Yeah.
God, grant me the serenity to accept the things that I cannot change,
Yeah.
the courage to change the things I can, and the wisdom to know the difference.
Yeah.
So the first part of that has to do with regulating anxiety.
Yeah.
That if you can't change it,
Yeah.
there's no point in being anxious about
Yeah.
it.
Or
You can
control
think
it.
about how,
Yeah.
yeah, you can think about how you're going to respond to it,
Yeah.
but you don't stress out over things that you cannot change. That's the rule, and with a lot of these rules, it's easy to say, it's much harder to do.
Yeah. Oh yeah.
But it's still good to have the rule.
Yeah. No, that's beautiful. And I think that that is a perfect place to end. The serenity prayer kind of wraps it all up. So thank you, Dr. Hagan, my friend Terry, for joining us today. As always, this has been so enlightening and such a great conversation. So I am sure that the audience has learned as much as I have. And if you guys want to see more of Dr. Hagan, and he talks about this Society of Anxiety and how he has a course that he's putting on. And it's an outstanding course. So what you saw today is just a preview of what you're going to see in that course. But you can find that coming soon, right? It's not up yet, but it will be. Not to put any unreasonable expectations on you, but it will be coming soon.
That's right.
So you can go to his website at haganhealth.com, and that's HAGAN health.com. And again, that's going to be the Society of Anxiety, and it is wonderful. And if you need help or you just want to walk together on your eating disorder recovery, you can check me out at ourworldempowered.com. And so thank you so much for spending this time with us. And there is more to come. So keep tuning in, and we will see you later. Bye, Terry, and thank you so much.
Thank you, Kim. Good to talk with you.
You too.